we are in the middle of summer, but parents, school boards, teachers unions, they're all thinking about the fall. Schools nationwide are preparing to welcome children back into the classroom this fall. But what that is going to look like, well, that kind of remains up in the air. After declining steeply for 6 months, COVID cases are surging again in some U.S. states. And while the CDC says that it is very important to have all campuses open for in-person learning, children are not immune to the highly contagious Delta variant. More than 4 million kids have been infected during the course of the pandemic. There are fears that number could grow as COVID restrictions continue to loosen. So Laura Podesta is joining us now from New York with more on this. Laura, it looks like this year's back-to-school list, aside from pencils and crayons, it's going to include masks as well.
That's right. Good morning, Anne Marie. According to the American Academy of Pediatrics, they say that all students ages 2 and up, no matter their vaccination status, should be wearing masks in the classroom come September. So health experts are telling parents if your child is eligible, if they're 12 or older, now is the time to get the shot. With school starting soon, time is running out for children 12 and older to get vaccinated and be fully protected against COVID-19.
You need to have your first dose, and then your second dose is 21 days later. And then generally what's considered fully vaccinated is 2 weeks past that.
Dr. Sean O'Leary of Children's Hospital Colorado says younger children should wear a mask.
This Delta variant, it is much more contagious than what we saw circulating last fall.
New guidance from the American Academy of Pediatrics recommends that masks be worn in schools by everyone 2 years of age or older, even if fully vaccinated.
COVID is not gone. COVID is here, and COVID is going to stay with us for a long period of time.
Health experts point out that fully vaccinated people, even those who get a breakthrough COVID case, are rarely ending up in the hospital.
What we're seeing is the person that got vaccinated is home with mild illness, and other family members that are not vaccinated are in the hospital, potentially with more severe illness or even in the intensive care unit.
In North Dakota, where fewer than half of adults are fully vaccinated, 40% of hospitalizations are people between the ages of 18 and 49.
Because the older folks are protected, the cases that you see and the deaths that you see are going to be in that younger, healthier age group just because they're not vaccinated.
A CBS News YouGov poll found among those unvaccinated, 74% say they will not get immunized, even if their own doctor recommends the vaccine. Last month, an increasing number of unvaccinated adults say that they are worried about the side effects, they don't trust the government, and they don't trust the science, Anne Marie.
Yeah, in a way, I'm no longer surprised by that statistic. So the CDC shared guidance on how important it is to open schools full-time and recommends what they're calling sort of a layered mitigation strategy. Do we know what states are actually planning on enforcing masking rules in schools?
Well, ultimately, the White House says that they're going to be leaving it up to the states to determine how to enforce mask mandates. So the governors and potentially state legislatures, if they create laws, will be the ones telling citizens whether or not to wear a mask at any time and whether they're vaccinated or not vaccinated. Governors, in turn, say that they are going to leave it up to state officials and school officials, to say whether a district should enforce a mask wearing at schools by having a student perhaps leave the classroom if they choose not to wear a mask or leave school that day. So it's going to be a bit ad hoc as far as state by state how each one will deal with the situation of schools reopening and how students will be treated if they show up without a face covering. I'm assuming, that it's going to look a whole lot like it was earlier in the pandemic with the general population as a whole, where we had the bluer states, which with more stringent restrictions and mask wearing, and the red states more lenient. Anne Marie.
Yeah, that totally sort of makes sense. Well, we'll be watching. I got a kid, you got a couple of kids. We all want to make sure that they're safe, but we also want to get them back into some sort of school, a regular school environment. Laura Podesta, thank you so much.